Today, we will be covering for our 2025 benefit information, our coverage, medical benefits, pharmacy benefits, what's new for 2025, wellness programs and tools, as well as tools and resources. Blue Cross and Blue Shield FEP program has a plan that's always by your side. That is the benefit of Blue. Today, FEP covers over 2.8 million families, including federal employees and their families, as well as retirees and their families. Learn why 99% of our members choose to stay with us year after year. Now we'll get into our coverage. We have plans designed to fit every need as well as every budget. Our three plans are the FEP Blue Focus, FEP Blue Basic, and FEP Blue Standard. We have a network that you can count on. All FEHB plans offer 3 levels of enrollment. Self-only, which covers just for you. Self plus one, which is coverage for you and a family member that is eligible, such as a spouse or a child. And we have self and family, coverage for you and multiple eligible family members, such as your spouse or children. We also offer quality care in all 50 states. With a large nationwide network of doctors and hospitals, in-network care is never far away. With 2 million plus doctors and hospitals, as well as 55 plus thousand retail pharmacies. Members of all three of our plans have access to the same network of preferred doctors and hospitals. Members enroll in the FEP Medicare Prescription Drug Program have a larger pharmacy network. With each of our plans, you'll receive free preventative care from in-network providers, referral-free care from specialists, worldwide coverage, as well as wellness rewards and discounts. Now let's take a look at our first plan, FEP Blue Focus. FEP Blue Focus gives you quality in-network coverage designed for your needs and budget, including your first 10 primary care and specialist visits for just $10, low premiums, and a reward for getting your annual physical. FEP Blue Basic, our second plan. The FEP Blue Basic gives you access to great in-network care. That includes preferred and non-preferred drug coverage, no deductible, up to $800 Medicare Part B reimbursement, and out-of-pocket costs that are mostly copays. Lastly, we have our FEP Blue Standard. The FEP Blue Standard gives your flexible coverage, which includes preferred and non-preferred drug coverage, up to $25,000 in coverage for assisted reproductive therapy, also known as ART, access to the FEP mail service program, as well as in and out of network care. Now we'll get into our medical benefits. 2025 benefit highlights. These are for our commonly used benefits and what you would pay for an in-network provider. These benefits are broken down into a comparable chart for all three of our plans. Continuing on with those commonly used benefits, now we'll get into deductibles. For our FEP Blue Focus policy, there is a deductible included. For our self-only policies, that deductible is $500. For our self plus one and self and family, the deductible is $1,000. Our FEP Blue Basic policy does not have a deductible. And our FEP Standard policy, for our self-only plans, that deductible is $350. For our self plus one and self and family, that deductible is $700. Deductibles only apply to certain services for our policies. Next, we'll talk about the out-of-pocket. Our out-of-pocket maximum for our FEP Blue Focus policy, self-only coverage is $9,000. Self plus one and self and family is $18,000. FEP Blue Basic self-only policy is $7,500. Self plus one and self and family is $15,000. And for our FEP Blue Standard, self-only out-of-pocket is $6,000. And for our self plus one and self and family, that out-of-pocket maximum is $12,000. Keep in mind, the out-of-pocket maximum is not an amount that has to be met, but it is an amount set in place that if you were to meet this out-of-pocket maximum during the calendar year, for all covered services, we would cover at 100% of the plan allowance. Now, let's get into our premiums. For the 2025 benefit period, FEP, FEHB biweekly premiums for our FEP Blue Focus policy, self-only enrollment code 131. The biweekly premium is $59.17. For the self plus one, enrollment code 133, the biweekly premium is $127.21. For self and family, enrollment code 132, The biweekly premium is $139.92. Moving forward to our FEP Blue Basic, self-only, enrollment code 111. The biweekly premium is $113.16. Self plus one, enrollment code 113 is $274.14. Self and family, enrollment code 112, the biweekly premium is $303.61. Now for our FEP Blue Standard. Self-only, enrollment code 104. The biweekly premium is $174.81. For Self Plus One, enrollment code 106. The biweekly premium is $384.14. Self and family, enrollment code 105. The biweekly premium is $424.65. Now, here are the premiums for our FEP FEHB monthly premiums. These rates are for our enrollees who are retired. For the FEP Blue Focus, self-only, enrollment code 131, the monthly premium is $128.21. For the Self Plus One, enrollment code 131, the monthly premium is $275.63. Self and family, enrollment code 132, the monthly premium is $303.17. For our FEP Blue Basic policy for the monthly premiums, we have the self-only, enrollment code 111, which is $245.18. Self Plus One, enrollment code 113. The monthly premium is $593.97. Self and family, enrollment code 112. The monthly premium is $657.82. Now for our FEP Blue Standard policy, self-only, enrollment code 104. The monthly premium is $378.76. Self Plus One, enrollment code 106 is $832.31. And our Self and Family, enrollment code 105, the monthly premium is $920.70. To learn more about your benefits and compare plans, you can do so by visiting our website, fepblue.org/compare. Next, we will get into our pharmacy benefits for 2025. Pharmacy programs for active employees. Our traditional family program is designed to be a convenient way for members to get the prescriptions that they need. It is going to be broken down for each policy. Each of our policies has retail pharmacy benefits. That includes the FEP Blue Focus, FEP Blue Basic, and FEP Blue Standard. For FEP mail service pharmacy prescription program, The FEP Blue Standard policy would be the only policy that includes mail order prescriptions unless you are retired and enrolled in Medicare Part B. You will have access to mail order or mail service under the FEP Blue Basic policy. For pharmacy benefits for members with Medicare, please visit fepblue.org/MedicareRx to receive additional information. What you need to know about retail pharmacy benefits in our program. Members have access to a large network of in-network retail pharmacies throughout the retail pharmacy program. Through this program, you can visit a local in-network pharmacy, such as CVS Pharmacy, or your local grocery store pharmacy to buy your prescriptions. For our policies, such as the standard policy, FEP Mail Order Services program allows you to get up to a 90-day supply of your medicine sent directly to your home. This program is available to all FEP Blue Standard members, as well as FEP Blue Basic members with Medicare Part B as primary. Our FEP Specialty Pharmacy program is available to all of our plans, including the FEP Blue Focus, Blue Basic, as well as Blue Standard. The FEP Specialty Pharmacy program is available to members who take prescription drugs for complex health conditions such as cancer. These drugs will be mailed directly to your home or your doctor's office. Up next, we'll speak about the formulary. We organize our list of covered drugs on an approved drug list called the formulary. In general, the lower the drug's tier in the formulary, the more cost-effective the drug. You're able to locate a full list at fepblue.org/formulary. You can also track drug costs using our drug cost tool at fepblue.org/RX. Now we'll get into the pharmacy tiers available for each of the plans. First, we'll speak about our FEP Blue Focus drug tiers. The FEP Blue Focus has two drug tiers. Tier 1, which is considered the generics, and Tier 2, which considers preferred brand name, preferred generic specialty, and preferred brand name specialty. For FEP Blue Basic and FEP Blue Standard drug tiers, there is a total of 5 drug tiers. Tier 1, which is our generic and most affordable drug type, equal to brand name counterparts in quality, performance, and intended use. Tier 2, which is our preferred brand name. These are brand name drugs that are less expensive and as safe and effective as non-preferred brand name drugs. Tier 3, which is our non-preferred brand name, safe and effective, but have a higher cost because there's a generic or preferred brand name alternative available. Our Tier 4, which are preferred specialty drugs. These drugs are used to treat complex health conditions. They are less expensive than their non-preferred alternative. And lastly, our Tier 5, which are non-preferred specialty drugs. They are safe and effective, but you'll pay more for these specialty drugs because there is a preferred specialty drug available. Now I have you to take a look at the retail pharmacy program cost shares of what you would pay for a 30-day supply if you were enrolled in either of our three plans. For FEP Blue Focus, Tier 1 would be a $5 copayment. And for Tier 2 drugs, you would be responsible for 40% of our allowance with a $350 maximum. For FEP Blue Basic, Tier 1 drugs fall under a $15 copayment. Tier 2 drugs have a $75 copayment. Tier 3, you would be responsible for 60% of our allowance. For these drugs, it is a $90 minimum. Tier 4, there is a $120 copayment. And Tier 5, which is a $200 copayment. Underneath the FEP Blue Basic, Tier 1 drugs have a $7.50. Tier 2, you are responsible for 30% of our allowance. For Tier 3 drugs, you would be responsible for 50% of our allowance. And lastly, Tier 4 and Tier 5, you would be responsible for 30% of our allowance for these drugs. Now, let's talk about FEP Mail Service Pharmacy Program cost shares. This is an example of what you would pay for a 90-day supply. For FEP Blue Focus, there is no mail service pharmacy benefits. For FEP Blue Basic, it is available again to members with Medicare Part B primary only, and you may visit fepblue.org for more information. Next, we have FEP Tier 1, you're responsible for a $15 copayment. Tier 2 drugs, you are responsible for a $90 copayment. And Tier 3, you're responsible for a $125 copayment under the Blue Standard plan. For FEP Specialty Pharmacy Program cost shares for a 90-day supply, for our specialty pharmacy under the FEP Blue Focus policy, Tier 2 drugs, you're responsible for 40% of our allowance up to a $350 max. FEP Blue Basic, Tier 4, you are responsible for a $120 copayment. And Tier 5, you're responsible for a $200 copayment. For the FEP Blue Standard policy, Tier 4, you're responsible for a $65 copayment. And Tier 5, you're responsible for a $85 copayment. In order to learn more about our pharmacy programs at FEP, you may visit our website at fepblue.org/pharmacy. Up next, we'll get into what's new for 2025. Telehealth visits. We now cover all telehealth visits from Teladoc Health at no out of pocket cost to you. A new additional benefit is our weight management program. For all three of our policies, we provide lasting lifestyle support with personalized tools, expert coaching, and convenient resources, all at no out of pocket cost to help you achieve your weight loss and wellness goals. For family planning and maternity updates, we have increased the option of free breast pump kits available to members who are pregnant or nursing. To order your free kit, please call 1-800-441-BLUE or 1-800-411-2583. We've also added as an additional benefit fallopian tube removal to our list of fully covered family planning services. For additional updates to preventative care, we will now cover adult RSV vaccines. Currently, these are covered as a preventative benefit for children only. We will also now cover the monkeypox or mpox vaccine for members at high risk for monkeypox infection. Overseas benefits. In 2025, we will waive the cost share for primary care, specialists, and outpatient emergency room services for our members overseas. Continuing on with the changes for 2025, there were changes to the FEP Blue Basic policy. We updated the copays for the following benefits: specialist visits, inpatient admission, outpatient visits and services, outpatient visits and services, preferred brand name drugs, Tier 2, and specialty drugs, Tier 4 and Tier 5. The out of pocket maximum has also been updated. This is not a full list of our benefit changes. To view the full list, download the Blue Cross and Blue Shield Benefit Service Plan at fepblue.org/brochure. Next, we'll get into our wellness programs and tools and who's eligible. So, who's eligible for those incentives? Our Blue Health Assessment is available for all three plans. The FEP Blue Focus can participate in that Blue Health Assessment without earning the reward dollars. For our FEP Blue Basic and FEP Blue Standard, you must be the contract holder or spouse, be 18 or older in order to earn the incentive rewards. Daily habits. This is available to all three plans. The FEP Blue Focus member can participate in the daily habits without earning the reward dollars. Next, the routine annual physical incentive. This is available to only our FEP Blue Focus members. And our pregnancy care incentive program is available to our FEP Blue Basic and FEP Blue Standard policy holders only. Now let's get into the Blue Health Assessment. Taking the Blue Health Assessment and getting a personalized action plan for a healthier you takes less than 20 minutes. FEP Blue Basic and FEP Blue Standard members can earn $50 the first time they take the Blue Health Assessment annually. Again, you must be the contract holder or spouse and be 18 or older in order to earn the incentive rewards. For the daily habits, this incentive is available to our FEP Blue Standard and our FEP Blue Basic members. You'll be able to complete activities related to your health and well-being, and members can earn a $40 incentive for each completed activity, up to 3, for a total of $120. Again, you must be the contract holder or spouse and be 18 years or older. For the routine annual physical incentive program, this incentive is available to our FEP Blue Focus members only. Those members are eligible to earn $150 on their My Blue Wellness card for getting their annual incentive. The member must be 18 or older and the contract holder or spouse in order to earn this incentive. Next, we'll talk about our pregnancy care incentive program. This is available to our FEP Blue Standard as well as our FEP Blue Basic policy members. After a first trimester prenatal checkup, pregnant members can earn $75 and a pregnancy care box filled with items that you can use during and after your pregnancy. For this incentive, you must be 18 or older and enrolled in our FEP Blue Basic or FEP Blue Standard. Now let's get into details of spending your reward dollars. Your My Blue Wellness card is a debit card that you can use to pay for qualified medical expenses and select items through the Blue 365 discount program. You'll receive the card the first time you complete an eligible activity. Each extra reward dollars you earn will be automatically added to your card. They do not expire as long as you stay an FEP member. Here are some examples that you can utilize your incentive rewards on: prescription drugs, acupuncture, eye exams and eyewear, doctor's office copays, lab fees, as well as dental treatment. You may visit irs.gov/publications/P502 to see a full list. You are also able to utilize your incentive dollars on non-qualified medical expenses. You can use up to $150 each year on select items available via the Blue 365 discount program, such as gym discounts, fitness apparel, meal plans and subscriptions, personal care products, and more. Something new that was recently introduced is Reimburse Me. You can also request reimbursements for qualified medical expenses purchased on a payment method that's not your My Blue wellness card. You can do so by logging into your My Blue online account, click Card Activity, and select Reimburse Me. Once your request has been approved, the funds will automatically be deposited into your bank account. You can learn more about our wellness incentive programs at fepblue.org/incentives. Now we'll get into well-being support. With your Blue Cross and Blue Shield federal program, you have access to 24/7 nurse line assistance. The nurse line offers 24/7 access to qualified registered nurses for health questions or care guidance at no cost. You may call 1-888-258-3432 or chat with them via our FEP Blue or My Blue account. Continuing our well-being support, you have telehealth services through Teladoc Health. Teladoc is connected with board certified doctors by phone or video, and you can do so anytime and anywhere at no cost to our FEP members. You can get care for general health, nutritional counseling, mental health, dermatology, as well as global care. Also provided to our members is our diabetic management program. This no-cost diabetes program by Livongo provides members with an advanced blood glucose meter, unlimited test strips, lancets, and one-on-one coaching from a diabetes coach. You must be the contract holder or spouse, age 18 or older, to receive this benefit. Here we will speak about our hypertension management program. If you have high blood pressure, hypertension, you can get help monitoring your blood pressure at home with a no-cost blood pressure monitor. You must be the contract holder or spouse and age 18 or older to take advantage of this benefit. There are also additional pregnancy resources available. For members who are pregnant or nursing, they can receive a free breast pump kit and a supply of milk storage bags. You can also receive a no-cost blood pressure monitor if you are pregnant, and you can learn more by visiting our website, fepblue.org/maternity. You must be the contract holder or spouse as well as 18 or older in order to take advantage of this benefit. The tobacco cessation program, which is available for all three of our plans, we want you to know that we're here to help you quit smoking, vaping, or using tobacco products for good with free tobacco cessation drugs, tools, and resources. You must meet the age requirement for prescribed tobacco cessation drugs to receive this benefit. Here are the covered drugs under our tobacco cessation program. You may choose from the following covered tobacco cessation drugs at an in-network retail pharmacy. For generic drugs, we have bupropion ER 150 milligram tablets, as well as bupropion SR 150 milligram tablets. For our brand name drugs, available is Nicotrol cartridge inhaler and Nicotrol NS spray 10 milligrams. Over-the-counter drugs would include Nicorette gum, Nicoderm CQ patch, and commitment lozenges. Next, let's talk about Blue 365. What is Blue 365? It gives members access to exclusive deals on health and wellness, products and services from personal care to travel. Joining is easy and completely free. All you need to do is log into your MyBlue account. With Blue 365, you'll get access to premier health and wellness discounts at 100 plus national brands and retailers, such as Crocs, Hertz, Sunbasket, Allbirds, Philips, Thorne, Casper, Philips Sonicare, True Hearing, Chewy, Samsonite, Walt Disney World, Fitbit, Skechers, and many, many more. Deals and discounts can change at any time. You may learn more about our health and wellness programs by visiting fepblue.org/health wellness. Now let's speak about tools and resources that are available to our FEP members. Our first tool is our FEP website. So you can visit fepblue.org. It is our public site where you can learn about everything FEP has to offer. You'll also have access to get more with MyBlue. MyBlue is our member-only site that gives you access to helpful tools and resources such as financial dashboards, wellness incentives, digital medical ID cards, and more. To get started, you can visit fepblue.org/sign up. We would also love for you to keep up with your benefits on the go by downloading our FEP Blue app. You have access to your benefits right in the palm of your hands. You can keep track of your out-of-pocket costs, find preferred providers, use your digital member ID card, as well as access the 24/7 nurse line and Teladoc Health. You must have a MyBlue account to access most of the app's features. Visit the App Store or Google Play to download the FEP Blue app today. Continuing on with our tools and resources, you're able to find the right plan for you. Our product selection tool can help you find the plan that's right for you. Just answer some simple questions and you'll automatically get a recommendation based on your needs. You can try out that plan by accessing accessblue.fepblue.org. You can also find in-network providers. Find a trusted provider near you no matter where you are. Easily search a network that includes over 2 million doctors and hospitals and over 55,000 retail pharmacies in the US.
Remember, you never need a referral to see a specialist. You can also search for certain treatments and get estimates on how much they'll cost you. You can do that by visiting fepblue.org/provider. Up next, know your prescription drug costs. This is our new tool that allows members to log into their MyBlue account and access a personalized drug cost tool that shows exactly your cost for a current prescription for a specific plan. You can get started by visiting fepblue.org/myblue. Thinking of visiting a in-person or online virtual event? You can find an event that is near your location easily. Search and register for in-person and virtual events. New events are added all the time, so check the page regularly. In order to access those events, you can visit the website fepblue.org/events to search and register. Here is our QR code for the Blue Cross and Blue Shield Federal Employee Program website. Scan this code with your phone's camera to learn more about FEP. In addition, you can visit fepblue.org, contact the National Information Center for more additional information by calling 1-800-441-BLUE or 1-800-411-2583. It is available weekdays from 8 a.m. to 8 p.m. Eastern Time, excluding holidays. And again, that number is 1-800-411-BLUE or 1-800-411-2583. We want you to keep in mind that for Blue Cross and Blue Shield, we have a plan for everything. That is the benefit of Blue, including our FEP employee program, Blue Cross and Blue Shield FEP Dental for your dental needs, and Blue Cross and Blue Shield FEP Vision for your vision needs. The Blue Cross and Blue Shield Federal Employee Program, Blue Cross and Blue Shield FEP Dental, and Blue Cross and Blue Shield FEP Vision are all separate, independently operated plans with benefits outlined in each of their respective federal brochures. And here is the information for the Blue Cross and Blue Shield FEP marketing team for Louisiana. You have myself, Dontorian Wilmore. I am the FEP marketing manager. We have listed our contact information, work, as well as mobile and email, and my two FEP marketing representatives, Brittany Martin and John Thorpe. Please do not hesitate to reach out to us if you have any questions or concerns that we can assist you with. We're always here to help. So thank you again for listening and obtaining the information for the 2025 Blue Cross and Blue Shield Open Season Benefit Year.